Welcome to the On the Pen podcast with your host, Dave Knapp.
Welcome to this somewhat more casual edition of On the Pen, the Weekly Dose podcast. I'm your host, Dave Knapp, man on the Manjaro. That's why I'm here. You are on the pen. That's why you're here. Wegovy, Saxenda, Victoza, Trulicity, Manjaro, Zepbound, Retatrutide drops. That's why you're here. And we're here to talk about all of the pertinent news in the obesity medicine space from this past week. I can't wait to get into it with you this week. But before we do, could you do me a favor and wherever you're watching, hit that like, hit that bell, hit that sub for notifications, help to prop up what we're doing here. If you're listening on the podcast, a little 5-star rating and a nice little review about what we do here at On the Pen goes so far to help move us up the charts, which is so important. We definitely lost some momentum back in May after I had the health issues that I was dealing with. And now that we're back, we're just trying to rebuild that momentum. So thank you all for those of you who are leaving reviews and comments and interacting with our content because it makes literally all the difference in the world. Thank you for being here. Thank you for being the best part of what we do. We're going to get into some interesting topics today. Can't wait to do it with you. Retatrutide drops, Retatrutide nasal sprays. Retatrutide is literally taking over the world, and it hasn't even finished phase 3 clinical trials. I can't wait to get into the topic of Retatrutide with you today. I'm going to start off the show by just saying heartfelt thank you to those of you who are paid subscribers on Substack. You provided a way for us to go to the Your Weight Matters conference in Washington, D.C. this past week, where we got the chance to advocate for expanded access to obesity medicine vis-a-vis the Treat and Reduce Obesity Act. So we spent more time, yet again, the first time we had to raise money to do it, we went on our own. We talked to some lawmakers about the importance of Treat and Reduce Obesity Act, about the importance of accessibility to obesity medications, about how compounded medications are fulfilling the gap, really, that our system and scarcity are leaving behind. This time we went with the Obesity Action Coalition. If you are not familiar with them, just do a quick Google search on the Obesity Action Coalition. But they have been the champions for the last 16 years of the Treat and Reduce Obesity Act, which, for those of you who don't know, would actually add obesity coverage to Medicare, which would cause ultimately more insurance companies in the private sector to pick that up. And so we were there advocating with them to pass the Treat and Reduce Obesity Act. It was a very, very encouraging time there, to be totally honest with you, sort of building on our first trip there. I was just shocked and impressed by each of the congressional and Senate offices that we visited in terms of their knowledge and breadth of understanding of the issues facing patients living with obesity, as well as the really amazing headway that we've been able to make pushing back against this disease with these current treatments. If you are tuning in on the podcast, let me know that you're here. Let me know where you're watching from. I'd love to see that in the comments. You can see that we've added a little thing here to the broadcast where you can actually see the comments. If you're listening on the podcast, you can always watch the video version of these podcasts over on YouTube, and we do them on X, and when Facebook isn't putting us in jail, we stream it over there too. But yeah, lots to get into on that trip. So say hi to Ella. She's here hanging out with me at the office today. You kind of getting a glimpse of her. We've got a different camera this week. You probably don't notice that we have a different camera. You may notice that you're looking at it from a different angle this week. I'm sort of playing around with a couple of things. I had to get a new camera. Why did you have to get a new camera, Dave? Well, the camera that I used the entire time we were in Washington, D.C., which is also the camera that I used to record the podcast, was left behind in an Uber, and unfortunately not an honest Uber driver. And we haven't been able to get the camera back, which has all the footage from the event, the Your Weight Matters conference. We took some great video there. We also took some great video of our golf event. We did a top golf event for the community. We had about 25 members showed up. I'm gonna just scroll some images from that meetup, because it was really cool. There was a lot of creators from both YouTube and TikTok. You may recognize this face here, Lorraine Durham and Christopher Durham from the Downsized. They do some GLP-1 news over at the Downsized as well. And so got to meet them in person, met them over. We did the podcast thing maybe like 6 or 8 months ago, maybe even longer at this point, but got to meet them. Got to meet Angela Fitch. She's the founder of Known Well, a interesting telehealth company, and her crew there. Really, really sweet gals here joined us as well. And then some of our favorite TikTok creators there too. You may not be able to see the picture super well, but Mike on a Mission, Jamie Selzler, who we just did a Faces of the Fight interview with, Sabina from GLP Winner over there, and just some really, really awesome people. Teddy and Zach from TikTok as well. Nate Platt from over on Instagram, if you follow. So just some really awesome people there. But unfortunately, I don't have any B-roll or any videos to show you because I lost my camera. And so that definitely turned out to, I thought the most expensive part of the week was going to be the golf event that we put on. Turns out the most expensive part of the week was the fact that I came home without a camera. So not only am I down that investment, but I had to invest in a new one. So always something, but I want to thank you to the paid subscribers over on Substack, $12.99 a month. You can visit obesity.news and you can become a paid subscriber over there for $12.99 a month. You just support the work that we do here at On the Pen if you find this information valuable, helpful in any way, shape, or form. So thank you so much for those of you who support our mission. We were able to support some other creators being able to attend that couldn't quite afford it on their own. So like literally those of you who are supporting the Substack are doing great things and allowing us to help the community in a pretty big way. So thank you for all of you who afforded us that opportunity. And we're not done until every person who needs access or wants access to obesity care can receive it in this country. We will not stop. We will not stop because unfortunately the lack of accessibility leads people to some really sketchy options to get treatment, because when people are desperate, they will inject pond water into their body if they were to believe that it would positively treat their disease. And so, I mean, that's literally where we're at in this country and kind of where we're leading off the podcast this week. You know, some very interesting things you may have seen in the thumbnail of the podcast this week. Something we've been following for a while. So there's a company out there. I'm not going to name the companies here, but they're out there. A company that has got some pretty reputable doctors behind it, including Dr. Drew. You may remember, I'm not sure whether he's an Oprah doctor or I don't know what he's from, but I've seen him on TV before, right? And he's one of the main people behind this company that is selling Retatrutide drops that go in your water with no prescription, no nothing, for $500 a month. $500 a month for these Retatrutide drops. Another research grade peptide company is selling Retatrutide nasal sprays starting at $350 for a month supply. Now, this is wild because we, and rightfully so, give a lot of flack to the pharmaceutical companies who bring these things to market at such higher and more exorbitantly higher costs than the rest of the world here in the United States. You know, for tirzepatide or semaglutide branded, you're looking at $1,000 list price, so $1,000 cost to our healthcare system here in the United States, where other countries are just a couple of $100s. You know, so we definitely spend our share of time encouraging these companies to reduce the cost of these medications. A special shout out to Novo Nordisk today, who announced a new CEO of the company. And we would just call on that new CEO to bring the price of Wegovy down to $199. It's time. If you want to be serious about maintaining market share, you got to drop the price. You got to make semaglutide accessible. You could really set the pace here for the industry and bringing down the cost of these medications. So Novo Nordisk, do that. It's overdue. But let's talk a little bit about whether these medications that are being offered, these presentations of Retatrutide, can work. So for those of you who don't know, Retatrutide is in phase 3 clinical trials. It will be the next best thing to hit obesity medicine on the market here in a year or so. Of course, before that, we get CagriSema from Novo Nordisk, but Retatrutide looks to be even better yet with some metabolic benefits that really are going to change the game, especially for people living with diseases like liver disease, fatty liver disease, MASH, these kind of metabolic diseases that are ravaging individual lives and our healthcare system on balance. But this medication has really taken the internet by storm. If you're on TikTok, you know that there are hundreds of thousands of people, I'm sure hundreds of thousands of people have tried research grade Retatrutide at this point. Research grade is this gray market, not for human consumption. In fact, we saw just this past week that over 80 senators and legislators, I should say, signed on to a letter to the FDA encouraging them to ban imports of research grade obesity medicines, because this is becoming crazy. Shipments of research grade peptides are snuck into the country, often through shipments that are marked as like dog food or anything but what they are, right? So they're being snuck into this country, and 80 legislators signed on to this thing, basically urging the FDA to take action. Now, the thing that I find interesting here, and we spent some time on the Hill, like I led off with this past week, is there is an understanding there of the desperation of people to get these medications, but the lack of action on the part of our legislators in terms of really doing anything impactful to getting these medications covered pushes people to the very areas that they're trying to stomp out. Listen, if branded medications were available at a price point that people could afford, if they were truly accessible, people would not go to the far reaches of the internet for these research grade versions. But in terms of these Retatrutide drops and Retatrutide nasal sprays, I just want to put this into context for you. These companies who have innovated nothing, who have created nothing, and have absolutely zero accountability for the safety and efficacy of the products that they're selling, are selling Retatrutide versions that are unproven, completely unproven when we talk about nasal sprays or drops that go in your water, completely unproven. They're selling these for $500. Listen, that's the price that you can get branded Zepbound, the leader in obesity medicine right now. You can get branded Zepbound for less than that right now through Lilly Direct. If you do the cash pay route, you can also get Wegovy for $499 a month through NovoCare. Listen, you can get the branded versions of these medications for what some of these companies are selling these bootleg, unproven, untested, and unregulated versions from. So it's not lost on me that people are being pushed to the far reaches of the internet for this stuff. But in some sense, these aren't even always cheaper options. Because people prey on the fact that people don't know and don't understand the fact that it's completely unregulated. And here they are thinking they're going to get something that's safe and effective because it has the Retatrutide name on it, and they've seen a TikTok video or they've seen a YouTube video. It's just the wild, wild west. So something must be done about this. But at the same time, something must be done about the cost of these medications. And that's why we have been fighting so fervently here at On the Pen to get access to care for all. Listen, I want to thank our partners, Roe, for bringing us this podcast each and every week. If you're looking at getting these branded medications like the Lilly vials for $499 a month or the Wegovy pens for $499 a month, that's all available through the Roe platform. Our partners at Roe really make it easy with their Roe Body program. And basically, the Roe Body program helps patients lose 15 to 20% of their body weight in a year when coupling these medications with lifestyle modifications, etc. And you can get the cash pay versions of these branded medications through our partners at Roe. So make sure you check them out. You check out roe.co/OTP, learn more about these medications, learn more about the potential side effects, but get access to them when appropriately prescribed. You can get access to doctors who can write these prescriptions and help you get them through the Roe program. And if you do that, you are supporting Roe, who supports On the Pen and helps bring you this podcast each and every week. Now, if you're somebody who does not use a telehealth platform, and you have the benefit of having a primary care doctor that understands the value and benefit of these medications. Oftentimes the challenge is just getting them covered, because you may have a doctor who really understands the value of the medications, but perhaps a doctor that doesn't understand what it takes to actually win an appeal with insurance companies. So if you've recently been kicked off of your Zepbound, maybe CVS Caremark force you over to Wegovy, listen, you should check out our other partners at Claimable. You can go to getclaimable.com/OTP, and Claimable for just $40 a month, and you can save 10% by using code OTP10. Get Claimable can help you develop a legal case, a legal argument, a medical argument, and then send an appeal to your insurance company to fight back against the denial of your obesity medication. And they're having an ever increasing success rate with helping people stay on the branded versions of these medications. Because wouldn't it be great if we could all just get the branded medications for $25 a month, or better yet, nothing, because our insurance is actually doing what we pay our insurance company to do, and that's cover medications that we need for a chronic disease. So Get Claimable, Row, a couple of great sponsors to the podcast. Always want to make sure that I mention both of those companies, because they literally are what help us to do things like this, and to go to DC and advocate for care and do all the things that we're doing. Now we're going to get into some really interesting news from this past week. Now, if you have been following along this saga, you know that Novo Nordisk has really had some tough go at sort of defending and protecting their patent against semaglutide. Now, on July 22nd, now we brought you this news 5 days ago. We brought you this news before any mainstream media was bringing it to you. That's why going to Obesity Period News, typing that into your browser, getting our Substack article is so important, because we're way ahead of the mainstream news and virtually anywhere else that you're going to get news. But on July 22nd, a federal judge handed Mylan Pharmaceuticals — Mylan is a subsidiary of Viatris, but Mylan Pharmaceuticals had filed back in 2023 a patent dispute. So it's a 2-year fight that they've had with Novo Nordisk, the maker of Wegovy, and this is a really interesting sort of turn in developments in terms of their fight against this patent. Now, this is all on the heels of Canadian generics coming for Ozempic in 2026, right? And India's Dr. Reddy's, which is a generics manufacturer of pharmaceutical drugs, announced that they will be rolling out to 87 countries next year generic semaglutide. So the landscape's about to change for Ozempic accessibility. But as far as the United States goes, they still have like 2020 or 2032 or 2033 on the patent here. But Mylan actually jumped a major hurdle in the cover in getting the ability to manufacture a generic version. So this is right here in the U.S. So this is a huge moment. So the situation is this: Mylan wants to make generic Wegovy, which is the GLP-1 medication semaglutide for obesity, one of the most powerful tools out there. It's about $499 a month cash pay right now. It's over $1,100, $1,200 list price. But Novo Nordisk currently has 5 patents listed for Wegovy in the FDA's Orange Book, which is kind of like where the patents for drugs live. And Mylan filed a challenge against all 5 of them to be able to make these drugs earlier than the patent expires. And this week, they won their first battle, knocking out the first of 5 patents, patent 9764003, for those of you following along. So that's big. This judge essentially said that the method of using semaglutide once a week to reduce body weight without combining it with another therapeutic agent is sort of what Novo's claim is. And Mylan, what the judge ruled is that Mylan's proposed use of this medication, which would be in conjunction with other treatments, would not violate that patent. So they got over the first patent. Now they need to get over the next 4. But if they are able to win these, ultimately we could see generic Wegovy, much earlier than 2032 or 2033. So they got to jump the patent hurdle. And then essentially what they have to do is they have to get FDA approval to make it as well, right? So they jump over the patent, sort of the legal part of it, right? And then they have to get the nod from the FDA to do it. So best case, if Mylan wins on the remaining patents or settles quickly with Novo Nordisk, which often happens if they start to, aggregate some wins against the patents, sometimes the pharmaceutical company will just come to the table and they'll just say, hey, let's make a deal. You may or may not win this. Let's make a deal. We'll let you make this as of this date, right? So we could see generic semaglutide launch as early as maybe late 2025, early 2026. That's a very unlikely scenario. Very unlikely. So much stuff has to happen, and the courts move so slow. So that's not super likely, but that would be the best case. The more realistic case is if litigation drags or settlement pushes back the date, a generic might not arrive until maybe 2027, but that's still earlier than the full patent expiration date. So it is something. Worst case, Novo wins it, and then 2032 or later is when we get the generics. But like I said, Dr. Reddy's is launching generic semaglutide in 87 countries next year. Hims and Hers is already filing to make generic Wegovy, or generic Ozempic, I should say, which is the diabetes version, in Canada next year. So we are going to see a major shift to the landscape. You just saw this morning, if you're following along, Novo Nordisk stock in pre-trading hours dropped like 20%. They announced the new CEO. Of course, his first job will be to protect the market share. And that's why I'm hopeful that the cost of Wegovy will actually come down in a meaningful way. But the first hurdle has been jumped over. You heard it here first at On the Pen about 5 days ago. We dropped this news while we were in DC. You've got to sign up. I mean, it's totally free to go to obesity.news and just put your email in, sign up for our newsletters. Those of you who wish to take the next step and become a paid member, again, like I laid out earlier, are really supporting the work that we do here at On the Pen. So I really, really appreciate all of you and just the support that you've given the work that we're doing here. I think what you've done is you've sort of voted with your pocketbook and said, you know what? It's really important what On the Pen is doing, and we're going to put $12.99 a month because we know that On the Pen is out there, fighting these battles, going to DC, having the conversations, pushing forward. So join us. That's the ask. I just want to thank those who have jumped on early and adopted that paid membership over there early. So thank you very much. So we already talked about how Congress signed on to the letter of that basically is urging the FDA to combat this illegal import of counterfeit GLP-1 medications. But one of the things that we haven't covered is the news that Metsera dropped. Now, this is interesting. Metsera is a $500 million startup that we covered at On the Pen back in January, and it wasn't really supposed to make another move until fall. Basically, they have some long-acting candidates of GLP-1 and amylin. Long-acting meaning this is something you'd take once a month, right? So obviously, if you're following along, and for those of you who do deep dive nerd stuff with us here, Maritide is another once a month, but the side effects have been abysmal with Maritide from Amgen. That's a 1 month monoclonal antibody. This is actually peptides that Metsera is working on. So tirzepatide, semaglutide. These are just peptide forms, right? So that's the delivery system. So let's break down what we heard from Metsera just yesterday, what they told investors, because this is really interesting news. Back in June, Metsera got people talking. So like I said, we talked about it in January. They kind of got more people talking about it back in June with their lead drug, MET-097I. The I stands for injectable. And it showed 11% weight loss after just 12 weeks. Once monthly injection, 12 weeks, 11% weight loss. That's once monthly for their injectable MET-097I. Now, yesterday, we found out that the phase 2 trials are fully enrolled. And here's the kicker. We're going to get data from 2 of those trials in September. So earlier than we thought. That includes Vesper 1 in the titration arm, because they just kind of slam people with the highest doses right away to get high weight loss, but then you get a bunch of side effects too. So they got a titration arm going. It's called Vesper 3. Those results will help Metsera sort of fine tune the dosing for the launch of their phase 3 trial, which is going to launch by the end of the year. Now, this is all really, really fast, really fast. They have moved these clinical trials along fast. They've enrolled fast. All these are really interesting, but the interesting thing for me here is the amylin. As a type 2 diabetic who has not responded to these earlier treatments as well as many others have, amylin, I think, holds an extra degree of hope and promise, because amylin is co-secreted in the pancreas with insulin. And because it is, there's a high likelihood that if you're diabetic, you're sort of dysregulated in the amylin too. And so these long-acting amylin analogs are very interesting. So Metsera's long-acting amylin is called MET-233I. Again, the I is for injectable, but they do have orals of these coming too. Posted 8% weight loss after 5 weeks. That's just the straight amylin. So you talk about the potential of combining MET233I and MET097I, the GLP-1 and the amylin. Listen, you're talking about a tremendous amount of weight loss in a very short amount of time. Now, I'm not saying that the faster the weight loss, the better, but I'm saying that the potency that these are showing show a lot of promise for people who don't respond to the current level of medications. Now, I know that's hard for a lot of you to even wrap your head around. How could you not respond to these medications? But that's sort of the mentality I think that a lot of people who don't need medication to lose weight have towards people who use medication. So don't get caught in that trap of sort of thinking the same way, like, well, these medicines work for me. I don't know why they don't work for you. I can't even eat. I can't even look at a cheeseburger on Ozempic. That's not everybody's case. Just like people who don't use medication to achieve meaningful weight management. It's just sort of the same mentality. So don't catch yourself getting into that trap. It's not a good one to be in. But Novo's caglarinotide is going to hit the market in 2026, sometime early. And it's a GLP-1 amylin, co-formulation. Metsera could be doing the same thing, but much more powerfully, right? And in a once monthly injection instead of a once weekly. Now, I know a lot of you are like, I like my weekly injection. Give me a shot every week. I like to feel it. I just like to feel alive when that medicine goes in me. I get that. I'm probably kind of that way too. In fact, there have been times where I'm like, I would like a daily. I wonder how I would benefit from a daily dose of these medications. Obviously, the clinical trials are designed to keep people in them. The medicines are designed to be as sort of, I can't, the word escapes me that they use in the industry, but adherence is kind of what they're trying to do. Like, how can we present this to patients so that they stay on the medication long term? And that's sort of the deal with any medication, right? So making it a once monthly means, hey, you're going to take it for at least a month because that's how long it's going to be in your system. But some people prefer that, some people don't. But the interesting thing, like I mentioned before, is Metsera also reminded us that they're working on an oral program. So MET097O. So we talked about 097I for injectable. O, you can imagine what that stands for. Oral, and MET2240 are candidates that are also in motion. We're supposed to get 4-week weight loss data on those oral versions by the end of the year. So will it compete with Rybelsus, high-dose Rybelsus, which is becoming this year? Will it compete with orforglipron, which comes early next year, small molecule oral GLP-1 from Lilly? We don't know yet, but if they can prove that these oral peptides work, that would be another lane that could potentially disrupt things. Now, on the topic of disruption, this is breaking news. The CEO of Viking Therapeutics. So Viking Therapeutics, again, we're getting into a lot of nerd territory here because a lot of you have to follow along really closely to know what some of these medications are that we're talking about. But Viking Therapeutics VK2735 is a injectable GLP-1 GIP combination. So that's the same formulation, at least, or the same hormones, I should say, that it's targeting as tirzepatide is. But VK2735 has shown to be probably more powerful and with fewer side effects. That's sort of the signals that we've seen early on in clinical trials. We learned from Viking Therapeutics that not only are they working on an oral, we knew that, but they are working on a once weekly oral version of Viking Therapeutics, early phase clinical trials, but they're working on a once weekly pill that you could potentially take, VK2735, and get similar results, hopefully. So even fewer. Like, I don't like pills. Like, if I had to take a pill for weight management, I would prefer that it's a once weekly instead of a once daily. I do like the once weekly shot. Like I said, I might even prefer a once daily shot just to have more steady flow of the medication in my system. But a once weekly pill would be a lot easier to manage, especially if you're somebody like me who's on blood pressure medicine, you're on maybe a statin, you're also maybe on something for your heart. It's just a lot of pills. So to take it once weekly would be very cool. What do y'all think about that? A once weekly from Viking Therapeutics. So that's in the works. You're not going to hear that anywhere else. I picked that up in the far reaches of the nerdery that takes place on the internet. Usually it's the investors, people looking at these companies to invest their money in them. And this was a comment that their CEO made sort of offhand, like, hey, we are working on that too. So how realistic it is, I don't know. Your guess is as good as mine. but it is something that is in the works. Listen, folks, that's what I got for you this week. I hope that you enjoyed the update. If you did, please just do me the favor, interact with the video, leave a comment, hit the thumbs up, and make sure that you subscribe. If you're listening on the podcast, leave us a 5-star rating and review. This has been fun to do this with you here live with you this week. If you got any questions, you can drop them in the comment section here. I'd love to answer any questions before we head out. It's always a pleasure to be here with you. I want to thank you again for helping us get to Washington, D.C. this past week. It was a wonderful time connecting with other members of the community. The golf event was good. The talking on Capitol Hill was good. And some of the side sessions that they did with the Obesity Action Coalition were very good as well. So give some love to the OAC, who is really, they're a patient-centric organization, really fighting the fight to really expand access to these medications and these treatments in a meaningful way. And they've been fighting these battles for over 20 years now. And you can become a member of the OAC for like $20 a month. So just type in Obesity Action Coalition into your Google machine, and it's going to tell you everything you need to know on their website about joining and becoming a partner there with OAC. I really appreciate the work that they do. If you missed it, we interviewed their CEO just a couple of weeks ago. And so that's on the podcast as well. It's one of our Faces of the Fight series. Listen, this is one of the most underrated series on GLP-1s that's out there on the internet right now. And it's not getting perpetuated by the YouTube algorithm. I'm not quite sure why, but over the last couple of weeks, we've interviewed the OAC president. We have interviewed the guy behind the legislation in Connecticut to basically have Connecticut make their own version of Ozempic. We interviewed that guy. We interviewed Jamie Selzler, who is a rising star in the GLP-1 community on Faces of the Fight. And the whole idea behind Faces of the Fight is these are the people that are fighting for you. Listen, when we talk about obesity as a disease, the only reason people don't laugh in our face is because organizations like the OAC have been fighting that battle for 25 years, or the Obesity Society, who's been fighting that battle for almost 40 years, my entire lifetime. We have them to thank for the conversations that we're able to have today. And gosh, I don't know about you, but I just want to be a part of taking it to the next level. So by the time that, one of my children could be behind a microphone someday and talking about health and wellness, that this conversation about obesity is so far in the rearview mirror because accessibility has expanded. The power of the treatments has expanded. All of this stuff is a rearview mirror conversation. Let's take this thing to the finish line together, right? Let's not let the folks who fought the battle to get the conversation to where it is today, let's not let that baton drop, right? And I think that's the real call here. So thank you to the Obesity Action Coalition. Thank you to everyone who was a part of that this past week. Big Sasha. So Retta is not out. Retta is in phase 3 clinical trial. So anything you are getting is a counterfeit version of Retatrutide, an untested version of Retatrutide, and an unregulated version of Retatrutide. So enter at your own risk is definitely the call there, right? So thank you again. Thank you for being the best part of what we do here at On the Pen. I appreciate each and every one of you, and we will catch you on the next one.